we're back at 12 minutes after the hour of 6 o'clock on a marvelous Monday. And I forgot, Jack, and you forgot to remind me. Lewis Hamilton, yes, he won at home. Yeah, British Grand Prix. First time ever for Mr. Hamilton, and he moves up in the standings. I think he's now just 3 or 4 points behind his teammate, Mr. Rosberg. Yeah, he looked good on the podium yesterday. It was a great race. I happened to see part of it. It was wonderful.
Yeah, and then we had a different level of racing championships, Caribbean motor racing championships here in Barbados at Bushy Park on the weekend. We had an opportunity to speak with the only lady who's ever hit the tracks on Bushy Park.
She hit the track?
Well, you know what I mean. You know what I mean.
You said hit, so I didn't know.
But I am sure she represented well. Really, really good stuff. Anyhow, we're going to talk some more about that as we go through the morning, but we're focusing on the skin right now. Yes.
That's right, and that
Getting
means
into my skin.
time to say good morning to Dr. Andrew Forde.
Good morning, Dr.
Hi, good
Forde.
morning to you.
All right. So,
Yeah, we want to talk about zits.
is it just girls who worry about acne?
It's everybody.
There you go.
Acne is a chronic inflammatory condition which involves the hair and its glands, and that's called the pilosebaceous unit. It represents itself as having inflammatory papules and bumps and cysts, but the thing that most people are aware of, you call them commedones, which are blackheads and whiteheads. But it's a serious condition because you can have scarring and discoloration, and it can affect you psychologically significantly.
There are different levels of acne.
Yes, it can be mild, moderate, or severe, but acne is a condition that affects mostly people who are getting into adolescence in the early teens, and it goes until usually the mid-20s. But there's some unfortunate people who can have acne for many years, into the 40s and even the 50s.
What causes acne?
Acne is really an occlusion of or a blockage of the unit, the pilosebaceous unit. You'd seen earlier on the TV that there was this hair in its glands that produces a lot of oil, and people who have acne have a blockage of that unit. So the products of the gland, which is called sebum, doesn't get out, and it stays under the skin, and that accumulation on the skin manifests itself as bumps. So on the monitor you can see what are blackheads, where the occlusion is plugged by a black center. So that's a blackhead, and we had seen the unit earlier as well.
How bad is squeezing these? Some people are addicted to
Squeezing
that.
always makes it worse because squeezing increases the inflammation of the condition, and that would lead to greater sequelae, which could be either discoloration or even the formation of cysts or scars.
What did you call it? Greater?
It makes it worse.
Okay.
It just makes it worse.
What's the difference between the blackhead and the whitehead?
Well, the blackhead and whitehead are the smallest representations of acne. The difference is that the whitehead, the blockage is just closed in, and you just see a skin-colored bump, while in the blackhead, there's a black plug in the center of this small unit that you see on TV.
Let me ask you this question. This must be another condition that needs to be treated, but there are people who go around just enjoying squeezing these things. And if you have one, say, let me squeeze that for you. What brings that on?
I think that's the manifestation of affection and caring how someone looks. Some people just love to squeeze, but certainly squeezing is not something you should do when you have acne.
Okay. All right. So, okay.
We're seeing some other manifestations. These are nodules, are larger variations of what we'd seen earlier. And then later on we'd see some other, if we see the next picture, we can see.
Can you mistake these for moles?
Well, no, I think moles are darker, they're stuck on, and they're not the same. Pustules are when the white cells which come in to fight the acne die and form this white accumulation within the structures, and they're bigger, they're painful, they're red, and that's a more severe form of acne. So we're getting into the inflammatory type of acne.
And then the next one is even more severe.
Yes, I'm going in stages of severity, and the next one is even more severe. These are cysts. Cysts can occur when you squeeze an acne structure, and the gland gets even bigger and stays on the skin. Sometimes the cysts can be dormant, or they can even be inflamed, and that can cause a lot of pain and discomfort for an individual.
Okay. Is it different how you deal with that level?
Yes, the treatments depend on the severity. You start with simple measures, which would include washing the face with a soap and water that's just mild and doesn't bother you. And then after that, there are other things you can do. People who have acne produce too much oil. So a lot of the treatments that are rub-on treatments involve getting rid of that oil. So some of the rub-on treatments are exfoliative. So things like benzoyl peroxide, sulfur, salicylic acid, glycolic acid, they're all things that you can rub on. But they also rub on antibiotics as well as rub on things that are vitamin A related, which are called retinoids. Retinoids make the surface of the skin develop more normally, and they also stop your glands from being so active.
Let's pause here, but I want you to explain the importance of the word non-comedogenic to people who have acne. But we'll take a break and we'll continue our conversation. We'll be right back.
Morning Barbados, good morning. Wake up, wake up, wake up. Morning to you.
We're back with you on Morning Barbados, and I myself have suffered with acne, so I understand the stresses that can be associated with it. Lucky for me, I didn't worry too much. I just looked for the fix. But the word non-comedogenic, I've come to learn that that is very important for acne sufferers to look for, especially on products, whether it's soap or whatever they're going to be using to clean the face.
Yes, it's certainly important. As I mentioned, people who have acne produce too much oil generally. So that's called seborrhea. So non-comedogenic means that you have a product that is oil-free. Because putting too much oily things on the face can cause acne, or even letting greases from your hair get on your face can cause acne. That's called pomade acne. That affects the hairline mostly. I think we were talking about some of the treatments, and we did mention some rub-on treatments, but some of the treatments are oral treatments as well. If your acne is more severe or inflamed or tending to cause scars or discoloration, you may need oral treatments, and some of the oral treatments can be antibiotics, some are hormonal like the pill, and then there's the so-called acne cure, which is called Roaccutane, which cures 90% of people with acne. This shows you some of the consequences of acne, which can be scarring. Sometimes the scars can be depressed, meaning they're very thin and the skin is pushed in as though someone took an ice pick and pushed it into the face, or you lost some skin from the surface. But of course, scars can also be thicker, which in people of color can be even more devastating because you can get a type of a keloid manifestation as well. And I think that's the next picture you'll see. But in addition to that, most individuals with acne are very concerned about the discoloration. That's the thickened scars or the hypertrophic scars there. That happens in very few people, but it shows that acne is not really a cosmetic condition for all people. Sometimes it can have serious consequences.
Serious.
I wanted to ask, though, about some of the very slick advertising that seems to address the problem of acne, when in fact it's just a very expensive wash, if you call it that.
Yes, well, advertising, is targeted towards the females mostly, and in many cases, the actual active components in the products are simple things that you can buy over the counter. All that is happening is that we have a nicely packaged product and lots of ads and celebrities endorsing the products, but they're things that you can buy for pennies on the dollar compared to what you would spend for that specific thing.
Look at that.
There are also many adjunctive things like dermabrasion or chemical peels, light treatments with that cause a sun-type reaction, injections, extractions. There's so many things you can do with acne, but some of the physical things are more cosmetic, but they're time-consuming, repetitive, and can be quite expensive.
All right. Can you say anything else about sweat as it relates to acne? Sweat? Does
Well,
that affect?
there is a form of acne called tropical acne that visitors get mostly on the trunk due to the heat and humidity in our type of environments. But sweating and also in humid conditions, people produce more oil when they're in very humid conditions. So sweating and oil production can make acne worse. And also even something like stress can sometimes make acne worse. A lot of people wonder also about diet. And diet is something that is, you know, specific to the individual. There's some people who, if they eat a high fructose or high sugar diet or high fatty acid diet, they can get acne, and there are others that eat anything or can eat
And it
1,000
wouldn't bother
chocolates and nothing happens.
You mentioned ROACT, and I just want to ask about that.
Yes.
Maybe you should say something about how serious that product is and the circumstances under which a doctor will probably prescribe
Well,
that.
Roaccutane is given to individuals who have severe acne that can cause scarring or severe acne that is not responding to treatments, or a prospect of prolonged acne into the 40s as well. But I really love Roaccutane. It's a very safe product once it's used properly, and the results are incredible. When you see someone who's had Roaccutane, the before and after is incredible. And as I said, there's so many psychological and other things that go with acne. You can change someone's life by putting on Roaccutane. It has to be given appropriately. It's
Right.
given based on your weight, and the end product, the end of Roaccutane has to do with taking a certain amount. But some people get bogged down into the amount of time they're on Roaccutane. I'm not a fan of low-dose Roaccutane treatments. I like people who are on Roaccutane to finish in 6 to 8 months. But while you're on it, you're not allowed to get pregnant. You're also not allowed to give it to people, and you actually have to sign forms and have blood tests to be monitored while you're on it. But
and
the
your
results
liver
are
should
incredible.
be in good condition, right?
Well, most people have a great liver unless they've had leptospirosis or hepatitis or some other condition that makes them impaired.
Okay.
But most people with acne are young people and they're healthy people. Another thing that you can look at, if you have gallstones and you have a problem with your gallstones, that can affect your liver, and that's one of the few things that affects young people. But I think there's a lot of misconceptions about Roaccutane, and also there are lots of lawyer-induced things with Roaccutane and other
Claims.
products, yes. But truth and in fact, I've prescribed it for 17 years. Roaccutane was given out by the FDA in 1984. It's a drug that's been around for 30 years, and I don't think, even though it's not in the U.S. the last few years, that it's something that's bad.
Dr. Forde, I want you to clear it for me, the difference between acne and what we commonly refer to as worms.
Okay. Well, yeah, Duck was talking about this phenomenon where if you
push
squeeze
your
your nose, you
nose.
see lots of little white things coming
Yeah.
out. Now there's dryness on the skin, and some people have a condition called keratosis pilaris, which is a very tiny papular problem that you get on the face as well. So when you squeeze it, the dry parts of the skin come out along the little hair follicles, and it looks like they're little worms coming out. But that's not acne, that's something completely different, and it has to do with if you use something that's exfoliating or fruit acid based, you can cut down on that phenomenon.
Okay, there you go.
Interesting, interesting.
It's still not so pleasant to see. All right, we have a final slide to share with you. Let's take a look at this.
Yeah,
one.
well, most people are concerned about the marks, and
yeah.
when individuals come to the dermatologist, they always say, well, I want to treat my marks. And if you scratch the marks, as you see on the right, it can make it worse. But the important thing is that you treat the cause and not the effect. And I think for patients, you have to understand, if you're having marks on the face, the only way you will ever get rid of them is if you treat the cause of the marks. But trying to bleach and to do other things to get rid of them will not give you a very pleasing and long-lasting result.
So you just have to try and resist the picking, which is very difficult, or
Yeah,
touching
picking,
them.
yeah, some people just pick too much, and we have to say that that's not something that we would require them to do.
Would you ever have to resort to surgery, cosmetic surgery, to address some of these issues?
Yeah, well, that has to do with scarring. Sometimes people who have scars or pitted scars, you have to use a filler to plump up those scars, or sometimes you have to inject them or do some sort of surgery. Dermabrasion is something that's better, that isn't used for people of color. I mean proper dermabrasion, not microdermabrasion that you get in salons and other places. That actually takes the upper layer of the skin off and leaves you with a bleeding dermis. So that's the type of surgery that we wouldn't really have here. because predominantly our population is people of color.
Wow.
What about what we commonly refer to as pox? You know, those spots on the skin. Are those caused by acne?
These are pox.
that
You mean on the
insects?
legs and
Isn't
stuff?
that
Yeah,
insect bites that people
most people have
scratch?
insect bite allergies. So within a family, there may be one person who has an allergy, and that person gets bitten. They may get a blister, or they may get something that turns out or gets infected. It leads to a mark. That's an allergy, and you know you have to prevention. Again, people get obsessed with the marks, but if you prevent the bites by using repellents, getting rid of water and grass from around the house, and having screens and that sort of thing, once you don't get bitten, you're fine. If that individual goes to the U.S. or another locale where there aren't insects, in 6 months their skin looks great. So it shows that, again, treating the cause is always better in medicine than treating the effect.
Okay.
That susceptibility or that allergy is what causes a problem. No?
Yeah, people who have that allergy have a problem called atopy. So within their family, they may have hay fever, asthma, eye allergies, nasal allergies, postnasal drips, asthma. These are all things that are linked with that allergy.
Okay.
But it can be very specific, and sometimes, as I said, only one person in the family gets it. So people wonder, why am I getting it? He's not getting it. Should I purge the blood? Should I do this? It's just an allergy that can be prevented.
All right. I still wear moisturizer and something with a sun protection factor in it every day. And often people of our skin color don't think they need to. Is that also important to helping those marks fade over time as well?
Yes, well, theoretically, using a sunblock does help the sun from making marks worse. But someone who has acne already is very oily. So for that individual, they have to use the minimum, especially if they're very oily.
Find one with
and also
oil-free.
maybe preventing, trying to avoid the sun may be an easier way. But you're moisturizing your skin, you have to give your skin what it needs. If it's producing too much oil, it doesn't need more oil, and you may have to do more avoidance of the sun. But someone who is dry needs some sort of moisturizer. And as I said, with acne, you need the non-comedogenic or oil-free moisturizer. That's the better.
And I found that.
Does acne mimic any other kind of skin condition?
Well, there's a differential or other options for a diagnosis, and rosacea is the biggest thing. Rosacea is something that causes redness. It's more common in Caucasians and people with lighter skins that flush. You get redness and you get pustules and papules. And sometimes you also have to be aware that you can take a medication and get acne. Like if you're asthmatic, or if your doctor thinks you have a bad condition or allergic reaction, and gives you oral steroids. Corticosteroids, if you're someone who's using anabolic steroids, or sometimes even the injection for birth control, that can cause you acne as well.
I've always been told from days at school when you're doing home management, you know, cleanse, tone, moisturize. Let's get a few tips for a good skincare regimen, and even if it includes washing your pillowcases frequently, I don't know. What would you say?
Well, we dealt with moisturizing already. If your skin is dry, you need to moisturize. And if you have acne, it should be non-comedogenic. Cleansing depends on how tough your skin is. If you're someone with sensitive skin, you have to use a white soap without perfume that wouldn't irritate. If you're someone with more robust skin, then you can use something with an alpha hydroxy acid or some sort of exfoliating agent. As I mentioned, kojic acid and azelaic acid, some other things. Toning just has to do with just removing a lot of those dead layers of skin. But again, if your skin is robust, you can do those three things. But there's some people who can just wash with a gentle soap and just apply a moisturizer.
Okay.
It takes time to find out what you can do with your skin. So you have to try things in moderation and add things in. You can't just do every step. Like if you buy something out of a box, you can't just do every step that's there. You gradually try to introduce the steps that are.
Okay.
Interesting.
So for
indeed.
people who work in my field, who use lots of makeup, what's the best way to get rid of that?
Well, you can use a simple remover to get rid of it, or sometimes you can use witch hazel or something just to rub it off. But the important thing is not to leave the makeup on for longer than you need it. And also, if you're in makeup and you're in very hot conditions, then definitely it's important to prevent yourself from having occlusion and getting acne.
Okay.
But that's
Again.
a discussion we really want to pursue that discussion, because there are those of us who
You wear
who
makeup too.
every day, you know, and we're curious about the dangers. Dr. Andrew Forde, always good to hear your perspective. Thank you for sharing with us on Monday morning.
Thank you.
And we'll be back with a look at Bridgetown of yesteryear, the cityscape, all that and more straight ahead on the Monday edition of Morning Barbados.